righty. We'll get started. And so this is about Medicaid, and Medicaid is really important for people with intellectual disabilities. And we just kind of give you an overview of what's happening, what potentially could happen. We just want people to be aware and ready. So some of the things you probably all are aware that we have a whole new administration up at the federal level. We have a new president and new representatives. And so what we are hearing, and this is what we hear from the ARC of the US, is that this session, we should not assume that this is going to be business as usual. This is an unusual time. And so we need to be prepared and be ready. Some of the things we're hearing, and you've probably read and heard some of these things in the news, is the federal government is interested in cutting the size and the role of the federal government. They're really interested in a smaller government. And they're also interested in extending and enhancing tax cuts. So those are two different things. They want to make the government small, and then they want to extend tax cuts. And then they really want to have an aggressive 100-day agenda. So the word on the street is they want to get in there and get going and do what they can. And when they cut the size of government, that's where we have to be alert about our programs and our services. There's a razor thin Republican House majority. So it's going to be very tight. So they will have to have all their votes for everything. So that's where there's opportunity when there's issues, because we can advocate, and sometimes it may only take one vote to swing something. So that's important to know. The other thing is there's a new Senate Majority Leader, and they will probably be leading things differently than they have in the past. We don't know what that's going to look like. And one of the big things that we're hearing is the majority party really wants to cut costs in Medicaid. And that's our stuff. That's our folks, and that's our stuff. So that's really important for you to know. And that's just kind of background information for everybody. Stacy?
Yeah, so most of you have probably heard next week will be super exciting. We're going to have a transition to a new governor. So Governor Inslee is leaving after 12 years as the executive lead for Washington State. He'll give his final speech next Tuesday, I believe. And then next Wednesday, our new governor-elect, Bob Ferguson, will give his inaugural address. And we're off and running. Governor-elect Ferguson has already been announcing new secretaries within the agencies. You all have probably heard that Cheryl Strange will be returning to DSHS. And she was our DSHS secretary about 4 years ago and went over to the Department of Corrections. And she will be the interim or acting secretary, probably through the legislative session, to help Governor-elect Bob Ferguson choose and select someone else. And just give him a little bit more room to make that selection. About 16% of the legislature is new. And so we know that we'll have to do a lot of educating. There's going to be not only a new governor with new staff, new committee staff for the legislature, and new legislators. We have to help them understand the world of developmental disabilities and some of the challenges and barriers that we face. So we are losing some older key leaders in both of our committees and within the legislature. That means that we have to watch carefully what the new leadership is going to know about developmental disabilities. And yes, somebody just wrote, Ian, it should be a B, Kathy. The slide says million, not billion.
Oh, yeah, it should be B.
And
yes,
right.
I'm sorry.
It's just getting there. And then unfortunately for this new governor coming in and this new legislature, they're going to be immediately faced with a very big budget deficit. Kathy, you want to go to the next slide? So we know that this budget hole of, estimated at 10 to 12 billion with a B dollars. Thanks, Diane, for catching that. That's over 4 years. That's not in one legislative session. What we have coming up is the long biennium session. So this session will go through April, and we'll look at a 2-year budget. And certainly we're going to be watching carefully for how they're going to fill in the gaps. What we understand is that this budget deficit actually started, and legislators became very aware of this before the pandemic. And then the pandemic hit, and we got this big flush of federal money, and the legislature used all that federal money to kind of fill in the gaps temporarily to make sure that people were well cared for and they weren't going into crisis, and the money was going directly to people who needed it. And now here we are as the federal money fades, looking again at this pretty big deficit. We know that it's not as a result of a recession. So those of you that are old as me and can remember the 2008 recession, it is not that same fiscal situation. We unfortunately have made commitments to state services that are not covered by the amount of revenue that we bring in. And that can be adjusted by adjusting the amount of revenue that comes in. That can be done by changing, taking away cuts, by adding other taxes, and that's certainly on the minds of legislators as they go into this session. Okay, next issue.
Sure. And when we have the conversation, first of all, we have this federal threat as far as the desire to cut Medicaid. And then we also have this hole here in our state. So one of the areas that they keep looking at is Medicaid, because a lot of other things in the budget are, especially in our state budget, aren't like as flexible. It's like like education, they can't really cut education because they're required to provide education, public education. So there's some mandates about that. So there's a lot of things that are mandatory that they have to pay for. And within Medicaid, there are some things that are not mandatory. And that's where we start to wonder about what potentially could happen. So that's why we're saying, we have this kind of the dual thing going on right now that we worry about. But knowing is being able to be prepared and to know how to act. So I just want to encourage you with that. Even though sometimes things sound scary, we want to make sure that we can act so that we can prevent things. So, and yes, so we do have a little bit of a stomachache about the situation between the federal and the state and trying to figure out how we are going to deal with that. So let's just go back to some basics about Medicaid. Some of you will know some of these things, some of you may not. So it's just some facts about Medicaid. So it serves more people than Medicare does. 1 in 6 adults and 2 out of 5 children in Washington are served by Medicaid. In Washington, it's about a third of births are paid for by Medicaid. In the US in general, it's higher than that. It's close to 50%. 20% of all personal care spending nationwide, whoops, I went the wrong way, is Medicaid spending, or personal health care, not personal care. So 20% of all health care nationwide is Medicaid spending. 12% of federal domestic spending is about the percentage. 1.8 million people are enrolled in Medicaid in Washington state. And prior to the ACA, it was 1.1 million. So that's how much it's grown over the past 10 to 12 years. Currently, our DDA budget is about $2.6 billion state funds and about $2.7 billion, federal dollars. So it's a pretty big budget. So who does Medicaid serve? So it serves low-income individuals like people with disabilities and people on SSI. It serves the elderly, poor people. It serves pregnant women, low-income pregnant women, and it serves low-income children. And also because of the ACA, what we call the Medicaid expansion, which Washington State embraced, there are other low-income people beyond children and those categories above. There's some low-income adults. It used to be those people were not served by Medicaid, and in some other states they are not. So how is Medicaid financed? Traditionally, Medicaid is a 50-50 match. The state pays 50% and the federal government pays 50%. Now, you should know that every state has a different match than others. So we're kind of one of the lower matches. There are some states I think that are as high as 80+% match. And it's based on the state's income, how rich the state is, or how many low income people they have in their state. And they decide what the federal match will be. So in Washington, it's 50-50. The Medicaid expansion, those additional people that came on after the ACA was passed, that has a much higher rate. In fact, for the first few, I think 5 years, it was 100% match. And then I think in 2020, it dropped down to like 90%. And I think for now, it's staying there. Some of the other program that we'll talk about in a minute, that the one that funds personal care, it has an enhanced match. So it's 56% rather than 50%. So one of the threats that we worry about is that the federal government can make changes about the state match requirements. And they can change what the percentage the state, the percentage differences between federal and state. But it also can dictate rules about what money the state can put forward to be matched. So they could change the rules around that. They could say, it only can be, revenue, new revenue that can be matched, or it can't be some of these. Sometimes states use other kinds of funding that they get other ways to match money. They may say, you're not going to do that. You just got to put the money up front. So those are some of the threats that we worry about. There's Washington and there. The other thing that I think is often really confusing is that Medicaid, people don't realize that Medicaid goes by a lot of names. So if you have Apple Health is Medicaid. And it also might be some of these other, now it doesn't, some people have private insurance with these insurance names, but a lot of the Medicaid plans are called Molina or Community Health Plan, Amerigroup, Coordinated Care, and United Healthcare. In many cases, those are, if you get your Apple Health through one of those, that is Medicaid. So I want to show you this graphic. Hopefully it will be helpful for you. Medicaid is a kind of a complicated thing. We think about Medicaid, most people just immediately think about healthcare, right? Medicaid pays for my healthcare. So, and most of Apple Health, that is, that's Medicaid. And there's a lot of things, that's the periodic screening and diagnostic and treatment, EPSDT, for children. That means they get to have the care they need. It pays for doctor's visit and hospital visits and therapies, traditional healthcare things that we think about. And that's the package that mostly we think about. But there's also community first choice. It's what they call a 1915B waiver. Sometimes they just call it a K waiver. It's a different kind of waiver than our DD waivers, but that part of that expansion and part of what they call a transformation waiver. They said, hey, if you put forward, you match some money, put some money out there to take some more people, we're going to enhance, you can add some of these services to your waiver for everybody that is eligible under Medicaid. And so that became community first choice. In our state, it's mostly personal care. So the thing is so it's Medicaid, that's for everybody. Personal care under community first choice is everybody that's eligible. So whether they have DDA or not, anybody that has a need for personal care and qualifies, takes the assessment, should be able to get community personal care service. There's a few other services on there, relief care, nurse delegation, that don't use as much, but that personal care is really important. It's also important to know that community first choice is not on our DDA waiver, right? And the reason it's not, they took it off at that time when the match went up for it. So because DDA waivers are just 50-50, they moved it took it out of there, and they put it in community first choice because they could get that additional 6% match. So that's one of the things. And some other states said, hey, we're going to get that additional match. We're going to and Oregon did this. Let's put all our DDA services over in that, what they call K waiver under community first choice, so that we can access that additional match. So it's just an interesting thing. And so again, it's not just the healthcare part, it's that personal care part. And then there are different kinds, what we call 1950C waivers. And that's where our DDA waivers come in, the IFS waiver, the Basic Plus, the Children's Intensive In-Home Behavior Support. And then on the ALTSA side, the Home and Community Service side, there's the COPES waiver, the New Freedom waiver, and Washington Residential Support waiver. So those are a different kind of waiver. There's the K waiver, and then there's these different home and community-based service waivers.
And Kathy, Kyle's got a quick question in the chat, the difference between Medicare and Medicaid in a short nutshell.
So
Kyle's asking the
Medicaid,
difference, yeah.
the difference between Medicaid and Medicare. Medicaid is a low income based program. It's for people who are low income, disabilities, and all those others. Medicare is an insurance program. People pay into it over the course of their life, and if they suddenly become disabled, they may qualify after 24 months. They can become eligible for Medicare, or if they're on their parents retire or pass away or become disabled, and they begin to receive Social Security disability income. So Medicare is based more on a work record. Medicaid is based on the fact that you are a low income individual.
Great, thank you.
Mm-hmm.
So just we can't emphasize this enough, almost all programs for people with developmental disabilities in particular are funded through Medicaid. Even though Medicaid is thought of often as a health insurance program, and it is the gold standard for kids in healthcare and access to healthcare, also the primary form of healthcare for adults with developmental disabilities, it also has our home and community-based waivers. And those waivers allow people to work, to get supports in the community, to live with their families, to live in their homes and not be part of institutional care. As many of you know, over the last few decades, we've moved a great deal away from institutional care. And really, we want to look more closely at serving people in the community. Medicaid is the only long-term care services and support system. So it's a big deal when they start to dismantle or look at changes to Medicaid for our particular group of folks. As Kathy mentioned, home and community-based waivers look at things like skilled nursing and transportation, assistive technology, environmental adaptations, crisis stabilization, person-centered planning, employment and respite, community engagement. It's really the umbrella service that we have for everything that matters for people living in the community. Next slide, Kath. Some people don't know too that actually schools are big collectors of Medicaid dollars. And so in our state, Medicaid can be collected by public schools, by tribes, by educational service districts. About 200 school districts in Washington collect against Medicaid for services to the tune of over $11 million. And these are health services, the services that are listed here. Nursing care, OT, PT, speech and language, audiological and counseling services, behavioral health services are included in that. It's critical for low-income students, actually, for schools to be able to collect. And about 50% of Washington State's students are eligible, low-income students, and would be eligible for Medicaid. So that's a large number. Medicaid increasingly underwrites a vast range of services in our public schools. And so those changes would also impact how we fund education and those services within education. Next slide, Kath. In addition, Medicaid funds early intervention for infants and toddlers. So about 4 in 10 children in Washington State are on Medicaid. It's probably higher for children that receive birth to 3 services. Birth to 3 is a program that does have some federal match under IDEA Part C, and it covers evaluations for babies and toddlers, individual family service plans, and many services under those plans to allow for the earliest intervention we can for children with disabilities.
So again, back to the Medicaid and the kinds of service. There are 2 things. There are mandatory services each state has, and there are optional services. Some of the mandatory services in this states must provide these services, and that's inpatient and outpatient hospital services, physician, midwife, and nurse practitioners, the early periodic screening, diagnosis, and treatment for children, labs, x-rays, family planning, nursing facilities for individuals over the age of 21, home health services, and non-emergency transportation to medical care. So those are mandatory services, which is great. And they're what we call state planned services. I think the state has to choose. And then there's the optional services, and this is where the state has to check the box to provide these services. And some of those optional services are prescription drugs, dental care, optometry, durable medical equipment, personal care. Again, that's optional. OTPT and SLP. Our ICF IDDs are optional, but Washington has chosen to check the box to have those. And those are our RHCs, ICF IDDs. Those are our residential habilitation centers. And home and community-based services, our waivers are optional. Thankfully, our state has chosen to check the box on all these things. But if you think about, a difficult time for our state or the federal government, and if they have to make difficult choices, this is what the place that they will often be looked at. Through the years in advocacy for the past, 30 years, dental care has come and gone as one that's like, are they going to fund it? Are they going to pull it or not? I think probably optometry. Those are probably the highest ones that come up, particularly for cuts over the course of time. So when we talk about home and community-based services, again, these are our 1915C waivers. Washington has 5. And then of course, ALTSA has their waivers, but if you think about Medicaid, everybody in Medicaid, if you think about this group over here, the different colors all mixed together, all the people that get Medicaid. But what a waiver does is it pulls out specific groups of people to, in addition to the medical part of Medicaid, gives them a list of services based on their needs. So we have 5 IDD waivers. Each of those waivers has a different list of services that are available to them. So you get Medicaid, the full Medicaid, plus these additional services. There could be, for our folks in ALTSA, have their own waiver, their COPES waiver, and it has its own list of things. There could be other waivers that are available. Some of the other states do them different ways, and they may have one for TBI or mental health or other things, but it's a separate list of specific things that are available to a specific group of people. And again, our state, respites, job support, community inclusion, residential service, habilitative services are all on our community-based service waivers. And there, again, that community first choice waiver, it's our personal care. It has that 6% match. It also funds a couple of those different ones, different services. When we got community first choice, because of the enhanced match, that is how we got our individual and family services waiver. Because it used to be our family services was not a waiver. It was paid for state only, by state only dollars, which means the state was paying the full 100% for those people that were on that waiver. And what they did is when they took that additional match, they were able to say, hey, we can take those people, and using that match, we can put additional people onto it and make a waiver, because we're going to get 56% match rather than just 50. And so the state was able to add additional people there. That was back, I think, in 2014. Stacy.
Okay, so as Kathy mentioned a little bit earlier, we don't see this as business as usual, and there will be some real viable potential threats that we're going to talk about next. We know that not only is Medicaid a target, but special education funding is potentially a target. There is some talk about reducing the size of or eliminating the U.S. Department of Education, weakening civil rights regulatory enforcements. There'll be some discussion about what will happen with the Affordable Care Act, which is really important for protecting people with disabilities and their pre-existing conditions. That also covers the long-term children's insurance program, CHIP. We know that the proposed head of HHS has concerns around the connection between autism and vaccines, which has been disproven. And that there may be changes to SSI, which serves as a basic source of income. That could involve changing things such as requiring work requirements or charging premiums. Those are things that we're going to talk about here. What we do know is that all of these potential threats really may push us back to an era where for people with developmental disabilities, there is a life of isolation, exclusion, and institutionalization. So that's what we're watching for. Right, Kath?
There you go. So one of the things that we hear when they talk about wanting to reduce the size of federal government and programs, and particularly around Medicaid, is there is a desire to do something called block grants. And block grants is where they say, right now, the federal government is giving, I'm just going to make up a number. We're giving $1 billion to Washington State for Medicaid right now. And what a block grant would do is we're going to give you $1 billion, and you guys can kind of decide how you want to spend it and do what you want with it. And at first glance, that sounds kind of good. It's like, oh, well, we could rewrite the rules and we could get rid of some of the bureaucracy and we could do some different things. But the problem with block granting is there is a guarantee that the federal government matches. And when our caseload grows, so if we have a recession, the challenge becomes that block grant, the original $1 billion doesn't really grow with the population. So if we have a recession and a bunch of people need to join Medicaid again because they lose their jobs, and the federal government isn't going to give you more money to do that. So it leaves the state in somewhat a precarious situation, and it doesn't necessarily, it might or might not go with inflation, and we've got a lot of inflation right now. It's a way to squeeze down the program over the course of time. Again, you don't see that problem in the beginning. It's over a couple of years that you begin to see that reduced more and more. Oops. Sorry, my mouse just did all sorts of things. So the other piece is what can happen is then we kind of lose the loss of entitlement. Um, you know, the federal government provides a lot of rules. You know, we all love to hate rules, right? But sometimes they're really important because they could say about who we should serve, or, or they could say, well, it doesn't matter how you spend it. So if you don't have to spend it on people with disabilities or other kinds of populations or other kinds of things that are maybe kind of important to us. So and it could also cause a problem for eligibility rules. So they could say, we're going to shrink who's eligible for various services. We could also see a way to deal with that loss would be waiting periods and limitations of services. So they'll limit the amount of services, and it removes the state entitlement so that, again, that the federal government right now, if the state puts the money out, the federal government has to match it. They could take that entitlement piece out. And I think I actually skipped a slide. Let's see. Maybe I didn't. Nope, I didn't. So that's under, the block grant. The other way that they could limit Medicaid and shrink Medicaid is there's something called per capita. Under a per capita cap, the reductions in federal spending are obtained by setting caps below expected spending. So they could say, state, we're going to give you X amount of money per person for everybody on Medicaid. And then we're just going to give you a big blob of money. It's similar to block granting, but it's based on the number of people you serve. The problem is, if you think about our population, we're the expensive folks, right? And we're going to cost more than the 3-year-old that's on Medicaid just for the health insurance part. And that's where it gets tricky. It's like, it's a way, again, to squeeze, and it doesn't is the per capita amount going to grow over the course of time, but most likely it's going to shrink. So people eligible for Medicaid based on disability age 65 plus account for 1 in 4 enrollees, but over half of all spending based on 2021 numbers. So again, here's kids. They're 34% of Medicaid, but they're only 14% of the budget. This is federally. People with the expansion, that's adults. And those are, often are younger adults that are poor. They don't take a big chunk. But then you get down here to our, other folks, other adults, it changes. But, here's our individuals eligible based on disabilities. They're 13% of the population, but 31% of the budget. So that's where things get tricky. And again, those based on age. As you age, they become more expensive. So again, we're just, between the age and disability, 23% of the Medicaid budget, but, more than 50% of the expense. Stacy.
One of the other things that we're watching for is a temptation to want to impose work requirements for people that are getting SSI and Medicaid. And what we know when this has happened in other states that do this is it has really the opposite effect. Most people with developmental disabilities are actually working to some extent, and imposing additional work requirements causes them to drop out of the workforce. Work requirements can also be very onerous in terms of reporting. By the time someone is able to do the level of reporting that has to happen, they often get cut off. And then there's a proving process. For those people who qualify, they have to continuously show that they sought out jobs and didn't get them or weren't able to work. And really the goal of work requirements overall is just to reduce eligibility and to reduce spending. So we're watching carefully for that.
Mm-hmm. And you have to think about a lot of our folks that maybe not DDA eligible, they just are over that cusp and are trying to work or trying to exist. And this is where it's very painful for that group of folks.
Next slide. And then, so the Centers for Medicare and Medicaid, CMS, as it's known as, is the federal agency that oversees all of these programs. So Washington State, every state has a very close and personal relationship with CMS. They are our partner. So they have a great interest in understanding what the state's committed to, since in our case, they're paying for half of those services that are eligible. The Centers for Medicare and Medicaid are in charge of enforcement and making sure that everything is running the way it should. And some of the concerns are that CMS will not be enforcing some of those important rules, making sure that people are living in the community, they're not institutionalized, that the states are doing things the way they're supposed to. In addition, we know that if it's left up to states, that puts more and more burden on states to cover the cost and enforcement, and that often doesn't go as well as we'd like it to go when the federal government is involved in those civil rights rules and making sure that all the contracts are being followed. Next slide, Kath.
Yeah, did it go? So one of the other areas of threat is we talked about those folks that are under Medicaid expansion. Our state was one that expanded the Medicaid again to adults that are over, low income adults, which usually were not eligible for Medicaid. So the threat is that there's some people that would really like to get rid of that completely. Now, some states, again, some have chosen not to do it at all, and there's quite a few that have not. But there are some that have taken it on, and the ones that have done it, they found that their overall Medicaid budget actually went down because it's a lot of preventive care for people to keep them from going into crisis. So this is just one of the areas. And again, this is one of those areas that we see our folks that are just over the cusp of DDA fall into this category. They don't fall under DDA as far as disability, but they still have a disability, and they need Medicaid for their health care. And this is where they fall, and this is where we worry about loss. And yeah, that they would eliminate it. The other thing that we worry about is that they would change the funding formula. Again, the 50-50 match. they could change that. And again, we had the additional 6%. They could take that away for the personal care hours. They could change the formula for the expansion, where they get 90%. So those are things that we worry about, that they would change those kind of formulas, which would reduce the cost of Medicaid, but it would also shrink the state's budget to be able to serve people.
And then there are things that the states can do on their own to try to contain costs. This could be the case in response to the changes at the federal level, maybe the case even in response to the budget deficits that we're seeing in our state that are unique to our state. So this legislative session, we'll be watching really carefully for some of these things. They have happened in the past. Some of them happened during the recession. And we know that these are not just existential threats. The first would be to change eligibility for services. So right now you go through a formal process for enrollment in DDA and in DDA services. And it could be that the state decides to change that eligibility criteria and will make it harder for people to become eligible or cut people off the rolls. Wait lists can start to formulate for services. They can cap programs, cap enrollment. They could start to charge premiums and co-payments for the services that are a part of Medicaid, and that would be those other health insurance related ones. They could change the menu of optional and mandatory optional services that they would offer under our state plan. And you saw that slide earlier from Kathy on what were optional services for us. It seems like vision every time, dental, those kinds of things certainly are first on the list to be cut when the state is experiencing some fiscal challenges. They can lower reimbursement rates to providers, cut those rates so that the providers have to reduce their costs, or providers take fewer people. And then they could make changes to the assessment. So when you take that assessment, it does calculate and translate to a certain number of hours, and it could be that nobody gets a large number of hours. Everyone will be relegated to lower service hours.
Okay.
Next slide, Kat.
Okay, yeah, I got go and answering a question.
It's okay. The next one is just, now we're going to talk about what we can do. So it's important, you're all here tonight because of a little sense of urgency, like what is going to happen? What should we be watching for? And you've seen the comprehensive kinds of services that Medicaid covers. If anything, it was probably a refresher for many of you, but I think a lot of people are always surprised at what Medicaid truly covers. And in the world of developmental disabilities, this can be a really big deal. So Kathy's now going to talk to you about some of the ways that you can get involved.
Yeah. So what can you do? And this presentation isn't to scare you. It's just to get you prepared and figure out the different kinds of ways that we can be active in protecting our folks from cuts. So what can you do? You can stay connected. The ARC has action alerts. We offer both the ARC of Washington has action alerts, and the ARC of the US. You can sign up for those as well to, just know what's happening kind of in the moment. You can go to the ARC of Washington's website and sign up there for our alerts, and also to the ARC of the US. You can also, begin to tell your story. And you always think about, you want to talk to your legislators, but you also want to talk to your community about how Medicaid impacts you. A lot of us don't even know all the things that Medicaid does. Your neighbor that doesn't use any of those services has no idea how important Medicaid is to you. And I think it's important to talk to our friends, our neighbors, but also to our decision makers and elected officials, whether they be state or federal, about how important those services are to you. you can make an appointment with your congressional delegation. It's difficult, but you can do that, and you can again tell your story and tell them how important it is. You can also call them. There's times when those action alerts say, "Hey, send an email, make a phone call." They swamp the phone lines with calls. Those are all options that those alerts will tell you about. You can also share information on social media. It's a great place to talk about your story about why Medicaid is important to you. Again, the general public does not know the importance of Medicaid. So those are things that you can do. Um, I would also add that we have our starting next week is Advocacy Day, our state advocacy day. We're going to need both state and federal support this year because we're facing very similar kinds of things. And those are on Wednesdays during the legislative session. Next week, it's live, although we're going to hopefully live stream it as well in Olympia at 10 a.m. And then the rest are all virtual. So you can go to the Arc of Washington's website and sign up for any of those weekly webinars. They're Wednesdays at 10 a.m. And we also record them so that if you can't come during that time, you can go back and watch them. So some of the language that we're really thinking about messaging we're talking about is do not cut and cap Medicaid. That Medicaid is our lifeline, and understand that people with disabilities rely on Medicaid to live their lives. So those are things that, that's a simple message that you can say, no cuts. And cuts cause crisis. It's much more expensive to have to take care of a crisis than it is to make sure people are cared for on a daily basis. Stacy.
So the things that Congress needs to know, Medicaid is the gold standard of health insurance. As I mentioned, it's the primary way that kids get access to health insurance, and it's the primary way that adults with developmental disabilities get access to health insurance. Our home and community-based waivers are Medicaid, and people often don't know that. Legislators don't understand that. A lot of people who receive those services don't understand that. And it's really important to know that it goes beyond healthcare. It's critical to people with developmental disabilities living in the community. That people with IDD receive services from many agencies. And, we call this death by 1,000 cuts. When the Washington state is looking at trimming down their budgets in transportation, we are affected by that because many of us access transportation. When they make cuts in childcare, our families are affected by that. When they make cuts in housing, our folks are affected by that. So we are affected in nearly every way in which the state government will be looking at shoring up some gaps. People don't understand that Medicaid helps people work. So for people with developmental disabilities, supported employment is under our home and community-based waivers. And that we're already underfunded. DDA is under-resourced. We are in the bottom 10 in the nation. It's important for Washington state legislators to understand that our ranking is very poor on a national level in terms of investment for services for people with developmental disabilities overall. We already don't have enough to meet the needs. And shoring up gaps in our budget and balancing the budget on the backs of people with developmental disabilities doesn't make sense.
Okay, and I want to show a quick video, but I realize I may not have clicked the share sound. So just a second. Some of our self-advocates created a video and I want to share it with you now. Oh. Okay.
And then Jean, I see your hand up. We'll get to your question as soon as the video is over.
Uh-huh. And if you want to answer questions while I reset it up, you could probably
yeah.
ask a short
Okay,
one.
Jean, go ahead.
My question is just where on the ARC website we'd find the links to the Wednesday advocacy days.
Yeah, if you go to our website at the top, it'll say advocacy, and you go to that drop down. And then there'll be an advocacy. Wait, I'm not looking at the website. There should be a tab that's pretty notable right there
It says Advocacy Day.
for how you.
Okay, perfect.
Let me go to it right now. Okay.
Thank you.
Okay.
Yeah, Advocacy Days is the first in the drop down.
Wonderful. Thank you.
Okay. I'm going to see if this works. I think Zoom may have changed, so I don't know if I hit the sound. Let me know if you can hear the sound or not.
Oops, we don't have sound, Kat.
Okay. I've got to figure it out. Keep answering questions and I'll get it going because I got to figure out.
Yeah.
Yeah,
that'd be
do you want to
great,
do it, Sean? Great. That would be great.
You might have to make Sean a co-host.
Yep, I'll make Sean a co-host. Are you under Sean or your mom?
Fine.
Okay. Where's Sean?
I don't see you, Sean.
Oh, here you are. Okay. There you go. Sean's going to share.
Sometimes it's hard when we're in presenter mode on a big Zoom to get it all to.
We can see.
Importance of Medicaid. According to Medicaid.gov, more than 10 million children and adults with disabilities rely on Medicaid for their health coverage. This population comprises about 15% of all Medicaid beneficiaries. I myself receive crucial home care services that helps me with daily living tasks. Let's hear from others about why Medicaid is important to them and why it cannot be cut.
My concern for cuts to Medicaid, it could really cut a individual's quality of life down. It's not safe to cut back on Medicaid costs for a variety of reasons. It's a individual's need for survival.
I do get Medicaid, Medicare, and Social Security, and I don't wish to see them get bumped or decreased because it helps myself as well as others that are retired.
My waivers help with my job coach and my caregiver, my long-term care, and it also helps with if I need extra training in a job or things like that. So
if I didn't have personal care hours, I wouldn't be able to get out of bed and do my activities that they were living, like eating, getting, dressing, all the daily things that I do to be able to work and be protective of the community.
And I just want to see that taken away from me or anybody else. Because it's good to be out in the community and having fun with your friends.
I need caregivers. I need Social Security because that's the only check I get. I don't get nothing else. So please don't cut it. Thank you. With getting older, I need more assistance with daily tasks. I really value, continuing those services in order to live a full, productive life. No.
don't
Don't
cut
cut our
services.
services.
For people too.
Thanks, Sean. Yeah, the last slide was just our Stacy and I's contact information. We can put that in the chat box. So One of the things we're going to be doing at our advocacy day is having opportunity for people to do just like what you just saw, to be videoed and say what Medicaid means to you, and we'll hopefully make them into short, like 30-second things, and so that we can use them on social media. You're welcome to send us videos. If you want to make your own 30-second about what Medicaid matters to you, we can put them into a template later and edit them to fit into the template. We'll be using, we have some messaging signs that we'll use along with it. Medicaid matters, don't cut our lifeline, things like that. So we hope you can join us at our advocacy day.
A lot of you have new legislators. It's a great time to welcome them to the legislature. They're new. They want to hear from their constituents so much. And for you just to tell your story matters a lot to them. So if you were ever inclined to do that, now would be the time.
I'm going to be hopefully going to that.
Thanks, Emily.
Great.
Yep, and I also signed up for the advocacy day too, so you'll see me there as well.
Wonderful.
Yeah. I'm trying to see if there's any other questions in there that we need. Yeah.
I
How do you
agree with
know if
every
you
one of you
got a
guys when you
new?
save our benefits.
How do you know if you got a new council person in your district? How can you find that out?
Yeah, I'm going to put the website. So what you should know is all the new legislators are not listed on the website yet. Probably not till next week, maybe even Wednesday. But I'm going to put the website where you can go and find them in the chat box. And it lists, you can look up your legislator here. Here's the leg.wa.gov. And if you go to, let's see, find your legislative district, there's a specific site.
I got it in there, Kath. Find my district.
Oh, you got it in there. Great. Great. And here's the find your district one too, so that you can see. But again, they don't have, because they're still deciding on a couple of people that they have to be appointed. So we'll see. Yeah, Sean, can you put a link to the sale video in the chat box so they can share?
Yep.
Thank you.
9.5.
Yep. So we hope that you will all feel like you are prepared to talk about what's good and why those services are important to you, because, you know, being prepared and being vigilant and being proactive helps protect our services.
And we're here for you after this presentation. Kathy and I are both available for any questions you have, and we hope you'll join us on some advocacy days and get involved. And thanks for sharing your dinner hour with us.
Thank you.
Thank you.
Thank you. Thank
so
you.
much.
Thank you.
Great presentation. I just got ask one quick deal. On their federal match, do you know if by chance are they gonna, like any services? It doesn't have to do with Medicaid, Medicare, but the any type of program under medical, especially medical, because I know that perchance that, hey, what's the non-essential, but if they take those non-essential, what's gonna happen?
Yeah.
Because
We
I'm under
don't know.
Medicaid, Medicare dual complete through my insurance.
Yeah. Yeah. A lot of our folks are. You know, we don't know. This is the thing. We don't know what they're going to do. What we're trying to do is be proactive and say, let's make sure that you don't do the bad stuff. We want you to protect it. So we don't, there's a whole bunch of different things they can do. And, you know, they may do all of them or they may do none of them. And we're hoping that there's as little pain as possible in the process. So
Yeah. Well, that's one. Hopefully, no pain, because to me is that there has been a lot of threat I mean, what he's going to do a lot of threat otherwise, but otherwise, and he's got his 2025 plan that somebody came up with that says that what's other non-necessary programs can we cut back?
Yeah. The
And
Project 2025 had the Medicaid block grants in it. So that's one of the things that they were looking at. So
yeah, what about our defense spending? What about other services that are not, I mean, half essential, but not there, not enough where they can say, hey, can you take a cut? Rather than the programs that are needed.
and I think Medicaid is more vulnerable than Medicare because we're a smaller constituent. See, you know, we have a smaller voice. Often our folks don't have the strong voice that if you start talking about Medicare, your people come out of the woodwork because it's, you know, all the senior lobby will come out and other people as well. But for our folks, again, because people don't know, Medicaid becomes more vulnerable.
I have a question.
Mm-hmm.
Is it okay?
Yeah, go ahead,
To
Barb.
ask? So, if they would choose to either change the assessment or change the eligibility requirements, would people who currently receive services, let's say like on the core waiver, might they be dumped because they might determine through a change in the assessment that they don't really need that anymore, and then everything that goes with the core waiver would go away?
I mean, that there's potential there for that. We hope that we don't come to that, is what we hope. I think because it's kind of an all or nothing. If you change the eligibility, you know, that shrinks the population of this folks with when they do the assessment, you know, like your personal care assessment, and they shrink that, that usually just means your hours go down rather than, although they could potentially, you know, if it says 3 activities of daily living, they could say 4, they raise it to 4 activities of daily living. So there's a lot of ways things can happen. We hope that we're just not going to come to that. So
We can
Emily, you've
always
been
hope
patient.
and pray that nothing gets cut, nobody loses anything.
Yeah.
That's the hope.
But what I think they're gonna probably do is not let people in DDA, like new people. They'll probably keep people who are already being served.
It's hard to say what they'll do. Hopefully nothing. Emily?
Hopefully.
I was just wondering, as we're a few days away from the new president, I was wondering what your thoughts were on just connecting, if you can, with your Congress people now and letting them know the importance of Medicaid, because I'm concerned that once something happens, it's like letting the bull out of the pen kind of thing, and that it's not gonna go back in the tube. Like it's not gonna the toothpaste won't go back in the tube once the change has been made. And so I was just wondering if the two of you thought that maybe like reaching out now and explaining how important Medicaid is would be advantageous.
Absolutely. Absolutely. Do it. You could do it tomorrow. You could do it tonight. So please do. Joanne.
Now I'm unmuted. Actually, I think when they come out to do a reassessment, what we see most often is an increase would be lovely in hours or a decrease in hours. But the other part that they're looking at is, it feels like us sometimes. Does the person receiving the services, do they still qualify for the services? So there's that part to it too. So you need to
Yeah.
be very careful. And I think we all need, just a little plug, we all need to go over the assessments and make sure that we're really telling the case manager everything that the person needs. And I always say, I'll never tell anybody to lie, but I will always tell you to be thorough in what you tell them that your needs are.
Yeah. That's great.
I think at the federal level, it's like playing two different kinds of games, right? Federal level is football and state level is baseball, as an example. So you have to get to know each of those differently. And the federal issues are very different from the state issues, even though the state issues are influenced by the federal framework. And right now, we know our congressional people are reaching out even to Kathy and I saying, could you make sure and get us stories? We need to have stories ready for when these things start to happen in Congress. And in Congress they started last week and they're already moving forward even before the January 20th inauguration of President-elect Trump. So they need stories now about how you use Medicaid and how any changes to Medicaid would be devastating for you. So you can get on that congressional communication quickly. There's also a Find Your Congressional Person app on Google. So you can easily do that. And then when you've got another hour, shift over to your state legislators. They'll start on Wednesday. Oh, they'll start Monday. The new governor will be sworn in on Wednesday next week. And then they're going to be really paying attention, especially folks in those human services committees in the House and the Senate. So good to tell your story.
Anybody in the 6th congressional district? We have, a congressional congressperson, Emily Randall, who was a state legislator who just got elected to Congress, who has had a sibling with developmental disabilities. So if you're in her district, she knows your stuff. You can keep that conversation going there. Joanne, did you have another question or was that from before? Okay. All righty.
Taylor has something, and I think Josie has had her hand up for a while, but it must be something different. Oh no, she's gone. Taylor had something, Emily. Yeah, Taylor's next.
Oh, it's just what you want to do is do your research on your new legislators and not just research like web research, but just get to know them on a personal level. You never know that it's a good thing to know if they have a loved one or somehow if they know someone who has a disability, because when you use that story and then you relate it to their story, that's it. I wouldn't say it's like a cure-all to get them to sway, but it's a lot easier for them to understand and influence a little bit them in a way that they're like, they can relate to it, to be able to understand the severity of the issue. And since I have a new congressperson in my district, so it's no longer Kathy McNorris Rogers, now I have to get to know Michael Baumgartner. So that'll be a whole new relationship. I have to, regardless of what I agree with him on in politics wise, I have to figure out a way to build that connection with him and get to know him kind of not only as a politician, but as a human being, and how it will impact that relationship, getting to know him as a legislator on also a professional level as an advocate, how I can make that connection with him to make him realize that we don't want to cut some of our most vulnerable populations.
That's great. I know that's one of those we have lost leaders, Kathy McMorris Rogers, whether you agreed with her politically or not, but she had a son with developmental disabilities and she knew a lot of our issues. So, those are things we lose. Yeah. But it always starts with that relationship, building that relationship to get to know them and educating.
All right, well, I think I'm going to stop the recording, Kath, and we'll let people get on with their evening. Thank you so much, everybody.
Yeah.
Very much.